Good day, dear viewers, and a very warm welcome to our Visite format. I am deeply moved by the many requests and also the many good wishes. I am allowed to read every time in your requests how you thank me. I think this is a cooperation, a law of resonance, that we are doing each other a favor. It is incredibly good for me to be able to share this knowledge with you, and vice versa, I hope, of course, and I also feel how important this information is to you. And all inquiries to me at Visite at QS24 are really welcome, and they are a good basis to select the corresponding questions and to make this program livable and active. And I would like to switch to a request from Fabio. Fabio is still very young, he is 26 years old, and he asks me, how much experience do you have with neuropsychiatric symptoms, such as obsessive-compulsive disorder or other serious diseases, such as schizophrenia, psychosis? And Fabio, you have provided me with a very sufficient document. You wrote that you have followed a large number of pathogens, which you have also come across in the context of, let's say, the training here in the program, but also have dealt with it yourself, of borreliosis toxoplasmosis via co-infections. You wrote that you have a very high level of EPX eosinophilia. This is a parameter that we take from the feces and that already leads us not only to malnutrition of the intestine, but also to food intolerances. You have carried out parasite cures and changed the whole diet. You have followed toxic things and you have described to me a detailed pamphlet, so that I can see an incredible self-initiative here and at this point. And from my perspective, I am not questioning anything at all. It was certainly all very valuable, very important, but you are not doing well with anxiety disorder and your psychiatric symptoms. I would like to take your request as an occasion to go into one thing more, because you do not only write about anxiety disorder, you also write about a slight tremor that you feel. You write about extreme reluctance. You write about vision disorders, which increase, about tinnitus, insomnia. You write about stressed compulsive disorders and also behavioral disorders. I would like to go into one thing and explain it to you. And you ask to go into this thing diagnostically, because I did not find any information about this in your explanations. What we always neglect is the question of the instability of our cervical spine. And that we only have to go into ourselves again or ask questions, because if there was, for example, a birth trauma, if the children do not come through the birth canal with their broad shoulders, certain misplacements can simply be the result in the area of the cervical spine. Why do I say that? Because the cervical spine is really the area where there is an extreme key position in the communication between the brain and the body. And the most important, which is simply responsible for it, and 80% of it goes from the body to the brain and 20% from the brain to the body, is the supply via the vagus nerve, the parasympathetic nerve. It supplies the stomach, the heart, the lungs, the mouth, the throat, it supplies everything. And because it is so vagabonded and in contact with everything, it is also called the vagus nerve. Because it controls breathing, it controls all the blood gases, it controls all the organ functions. But the states of the organ functions, whether they are throttled or hyperactive, it controls the blood pressure and thus the vagus nerve, by directing the information to the brain, first of all creates perception. That means the brain must now constantly feel a state via the vagus to perceive the state in the body. And it is very important to understand this. Because these so-called receptors are of course now very involved in the regulatory states. And normality actually means that the body can also remain in a certain stability in the context of this self-regulation. And who is responsible for this? This interplay between parasympathetic, i.e., vagus, and sympathetic, that is the opponent of the vagus, of the parasympathetic, that is then a control center at the top, which we call the island rim. The island rim is a part of the brain, there are three parts oblique. And that is the main part of this interplay. One is the information that hopefully comes up undisturbed and thus also triggers a certain normality in the sensation, or that in the interplay between sympathetic and parasympathetic. The evaluation of the information and thus the information on the sympathetic. But also the emotional situation is now actually adapted to this island rim. That means it perceives the inner state in the organism. It controls the regulation of the musculature. It also judges pain sensations. It is there when I want to articulate the words, when I can swallow or not swallow. It perceives basic events. Is it important to trigger a fear now, or is it not at all necessary to trigger a fear? Because fear can sometimes protect me. So one of the situation's adapted emotional reactions, anger, joy, sadness, so spontaneity, to experience situations adapted. The retention of attention and also, as I said, the great regulation of these two naval interplays. And that's why it's so important that the island rim can always balance between what I've experienced, between what I'm feeling now, between what I remember, experience. And also what I perceive now based on my subjective fear in the misjudgment, all subconsciousness. That means it has to constantly adapt to different emotional parameters. And if it is in this direction, of course, it is able to do so. And that's a point where I think if the opponent, the sympathetic is in a dominance because the vagus is being tricked, then that has an effect along the entire autonomous vegetative nervous system. That means this sympathetic is connected to all brain nerves. That means if stimuli take place in the context of these segmental cervical neck segments, then it can, and hold on, the circulation be reduces up to 80%. But what does that mean? That means that neuroendocrine nerve hormonal disorders occur, and that's because of this circulation throttling in the framework of the cervical spine. That can be a fall from the tablecloth, which you don't remember at all. That can be a bicycle accident, or my first, I say, attempts to learn to ride a bike. That can be an accident that the parents had and were involved in as a child. I just want to ask you to really go after this thing. But that can also be a chronic high stress, which of course causes constant muscular tension. And these stress hormones, especially in the area of the small brain and hippocampus, these are the areas that are just so, the stress sensitivity, they really act neurotoxic. They can be atrophied. That means they can be slowed down in their function. And of course, this also leads to the emergence of disease images, which one may try to influence on a physical level, but which also go back. And I just want to give you a few examples of what a disorder or dysfunction, especially in the insular bark, has as a result. That means, above an unstable cervical spine, it shows effects, and that is irritable bowel syndrome, again and again, bloating, or eating disorders, or fear states that I cannot assign, feelings and emotions of others really to understand, to show empathy. Even if I suddenly laugh or cry inappropriately, the situation is not at all given for it. Motor problems like tremor, minor, major tremor, trembling, also poor adaptation to my circulation, i.e. shortness of breath, I am not resilient, dizziness, swallowing disorders, chronic immune disorders. You should not underestimate what impact this has on my immune balance, and then of course as a result of infection, a lacking defense situation, viral reactivation that the body no longer gets control of, and also pelvic floor problems. So, this might be a help for you at the moment, to continue to look. This sympathetic irritation by an instability of the cervical spine, I have already wanted to tell you, I would not want to try to understand that you already have atrosia and disc damage up there at 26, but it is also about a certain damaged and thus motionless flexibility of the cervical spine, which then has a certain compression of the spinal cord, which is what now influences nerval, this bottleneck, but also circulation and blood circulation disorders. And these mechanical irritations of the spinal cord lead to a constant tension increase. This should not be underestimated, also in the case of the sympathetic. And in the long run, this can have a negative impact on the entire system. Mr. Kuklinski wrote a beautiful book about the HWS instability, cervical spine, and he writes that the sympathetic irritation, of course, is triggered by nerve activation, we are talking about it, then also by nerve inflammation, dysfunction of the brain nerves, all 10 brain nerves, then strong histamine outflows, but lead to late allergic reactions, but also from cerebral cells, i.e. the blood-brain barrier, which then causes such a high oxidative stress. And to analyze this, to follow this thing, also the consequences that arise from it, for example mitochondrial consequences, that is, that the energy supply is no longer provided by the mitochondrial cell energy plants, that this leads to multisystem diseases. So alone, Kuklinski's book shows 6 pages, only symptoms, which on this level only show the symptomatic picture, but are not the cause, and also chronic neurodegenerative diseases, the consequences. And that's why I want to let you and everyone else give you an important advice. Of course, we can measure this with a so-called nitrostress load in the urine, but what is very, very important for my terms is an uprate CT. And we can, with the uprate CT, all people are always put down, and when it comes to the head goes to the MRI. But you have to remember, it's about the cervical spine, about communication, and not in bed, what the body still compensates in bed. It's interesting that many Parkinson's patients are lying in bed in peace, but when they stand, when they get up, when they walk, there is this tremor. That means an uprate CT has to be done while standing or sitting, and more statements are given, not just about the structure of the cervical spine, about the edematous tissue, about the compression. There is an expression about the circulation possibility, unhindered and nervous control. And that's why it's a really, really interesting aspect, because over a long time, a communicative disorder can also occur. And I would like to ask you to follow these questions, so that they don't let an important story go down somewhere, because I can feel too deeply into how you feel when you're 26 years old and life is already so fixed in this problem, but it's so hard to clarify. But I don't know everything about you, and maybe I could give you a few more impulses that might be very, very valuable to you. Thank you very much for your email. We still have a little bit of time, and I would very much like to answer one more question. A young woman from Germany, 35 years old, wrote to me. She had a severe lipid disorder since last year and wrote, "What is the actual high point value of a helper's apherism, and what is the difference to an INUSpheresis?" And please let me give you an answer to that question. Both are excellent measures, but they are very different. Because the so-called helper's apherism is only there to help people who have high lipid values, i.e. fat metabolism values. And it is used as a dialysis to lower this high lipid level. This is a dialysis that we have known for over 15 years and that has a fixed point value. Both, the helper's apherism and the INUSpheresis, have the same procedure at the beginning. It is about separating the solid from the liquid. In the INUSpheresis, we use the plasma, which is the liquid, which we separate from the solid components beforehand. These are the blood cells, the red blood cells and the white blood cells. This is also done in the helper's apherism. We treat the plasma, and it goes through a so-called blood filter, which separates the solid from the liquid. This plasma alone, which is so highly loaded with lipids, is now given a high dose of heparin. Heparin improves microcirculation, releases coagulant, i.e. triggers the rinsing components. Now, an acetate buffer is added, which reduces the pH of the blood extremely. At that moment, another surface charge is created on the LDL proteins, also LPA lipoproteins. This leads to binding, which binds the fats to heparin and then they fall out. When they fall out, they can be exhausted. This process requires 2 phases. The third phase is also necessary, because by means of the dialysis, everything is removed and the physiological pH of the blood, 7.1, 7.4, is slowly buffered and restored. This is the effect of this lipid apheresis, which we also apply in the sense of a high disturbance with too many lipids. But only once, and then we do the INUSpheresis. The difference now is that the INUSpheresis is not only responsible for increased lipids, but here we use the plasma, and we only take 33% of the liquid, that this goes through a special environmental filter and everything stays there. And it's not just about lipids, it's mainly about toxins. Light metals like aluminum, heavy metals like lead, mercury, arsenic. It's about autoantibodies, inflammatory autoantibodies, circulating immune complexes, which of course also trigger other events, inflammatory factors, environmental toxins like glyphosate and bisphenol A, the softener, like nanoparticles and recently microplastics and a lot of pathogenic germs. INUSpheresis is of course supplemented with B vitamins, vitamin C, and also glutathione, which we need for detoxification, and this results in a high clearing process of the entire blood. We assume that about 1.5 times the entire blood. We see that every time afterwards, we calculate exactly how much blood volume has come, how much blood volume has been filtered, and then automatically the cleared plasma feeds back in. And that's the effect of an INUSpheresis on the apheresis. I hope that I was able to help both of you in the context of your questions. I thank you from the bottom of my heart for your attention today, again on our visit. I look forward to your inquiries at Visite at QS24 TV, and I wish you all the best for a good, beautiful, wonderful, sunny week. And I look forward to seeing you next time. Goodbye.